Okay, I'd like to welcome everyone. This is being recorded. Many of you I've spoken to already, or we've met on a different occasion. So welcome all of you to this meeting for prospective patients. And I'd like to reminisce a little bit. I used to have a radio show called Healthy Vision Talk Radio, and believe it or not, it was broadcasted for 22 years out of Phoenix, Arizona. Imagine that, every week for 22 years. And so I really enjoyed it. I enjoyed answering questions from patients, and I also enjoyed interviewing different people. So you can see my screen, and I'd like to play the intro to my radio show.
Tune in for Weekend Talk That Matters, only on KFNX.
Nessun Dorma from the opera Turandot, I Will Conquer, I Will Conquer. Welcome to Healthy Vision, the talk radio show to help you conquer your vision loss. Dr. Edward Kondrot is a board-certified ophthalmologist and homeopathic doctor, author of 4 best-selling books, and president of the Arizona Homeopathic and Integrative Medical Association. Healthy Vision is dedicated to bringing you the latest information for a lifetime of healthy sight and to help you conquer your eye problems. And now, your host, Dr. Edward Kondrot.
Oh, that music is from my favorite opera, Turandot. And I think it's Pavarotti that's singing, Vincero, Vincero, I will conquer, I will conquer. And that's kind of like my mission. I want to help all of you conquer your vision loss. So if you're new to me and my program, one of the best ways to find out more is to go to my website, healingtheeye.com, all one word. And this is new to our site. I'm going to click this in a minute, but you can download my book right here. It's a free download. And I would advise you especially to read the first 3 chapters. They're probably the most essential, talking about diet, hydration, and reducing stress. There's also some information here on last year's vision event. We're getting things lined up for Vision Event 2023, and I'll keep you posted on that. So if you're new to the site, if you click this link right here and watch it not work. All right, come on. Anyway, when you go to this web page, it has a lot of important information. It'll have information on your particular problem and different treatments. So if you have glaucoma, you might want to click the link and listen to my webinar presentation. If you have macular degeneration, you may want to click that link, and so forth. Well, this is not working here very well. That's kind of embarrassing. Well, here, let me open up the lines here. I'm going to stop sharing. I may come back to this right now. Oh, here it is. Can you see that? Well, here it is. So step 1, become familiar with my approach. You can download my best-selling book right here. Or if you have problems with your vision, you can listen to the 10 Essentials webinar. You can also find out more about your condition. This is reversing cataracts, glaucoma treatment, wet macular degeneration, dry eye treatment, etc. Then there's a section here on common therapies that I use. Microcurrent, homeopathy, ozone, light therapy, and detox, and also some questions, frequently asked questions. All right, I'm going to stop sharing. And let's see, unmute everybody, and then let's see, I think maybe everybody's unmuted, or maybe you have to unmute yourself. Yeah. If you have a question, I guess a couple of different ways you can ask the question. You can put it in the chat. Type your question in the chat. Or you can unmute yourself and just ask it directly. How does that sound?
Good.
All right, I hear some activity out there. I'm glad I'm coming through. It's always embarrassing. Okay, here's one here. I had cataract surgery on both eyes this week, artificial lenses. Can I start using digital devices? Well, that's a really good question, because the human lens protects the eye from harmful light. And let me explain that. You know, there's good and bad light. There's been a lot of research that blue light at night can be very, very harmful. On my radio show a few years ago, I interviewed a Professor Hayam who has done research on this. So if you go to kondrotpodcast.com and search Hayam, H-A-I-M, it's a fascinating interview where he discussed the problems with blue light at night. We were meant to have blue light during the day. That's why God made the sky blue and the ocean blue. But at night, what happens when the sun sets? It starts turning to a reddish tinge. And so we need this to change more towards the red tones at night. And it's interesting, I have an iPhone. And they have a night shift on the iPhone. The brilliant engineers at iPhone, the screen shifts to a reddish tone at night, which I thought is fascinating. So those of you that do a lot of computer work or watch TV at night, that's when you should use blue blockers. Blue blockers block the blue wavelength of light. You need blue light during the day, so don't wear those blue blockers during the day. Only wear them at night. We need blue light during the day. So go to Kondrot podcast. Oh, and let me just, I'm going to go back here to share my screen. And let me just show you that. Oh, here, share screen.
Not there yet.
All right. All right. Is it there?
Yes.
All right, good. Let me just, I'll show you how to get to it here. I'm going to go to a different page here, vitamins. Oh, wait, I don't have to. You see this right here? This sidebar right here?
Yes.
This one here, big lie about glaucoma, cataracts. And here you can go to my radio show. Listen to some old radio broadcasts by clicking here. And it should take you to that.
Making noise.
There it is. I interviewed Tom Quackenbush. He's an expert on the Bates method. Some of you may have heard of Meir Schneider.
Yes.
I interviewed Meir. And here, Professor Abraham Hayam. According to Abraham Heim, the most dramatic environmental change in the last 130 years is the phenomena of light at night. This results in light pollution, which is linked to cancer, heart disease, obesity, and macular degeneration. But probably the best thing for you to do is to sign up for my podcast. You go down here. Instead of a radio show, now I have a podcast. So Apple, Google, Android, or whatever. So if one has not had cataract surgery, how late is too late to attempt a natural correction? That's a good question, because I think nowadays doctors operate too early. I've seen many, many patients who come to me with macular degeneration or glaucoma, and they tell me, my problems began after I had cataract surgery. And I said, when did you have cataract surgery? Were you having any trouble? And they told me they weren't having any trouble. They said, the doctor told me I had cataracts, and I thought, well, get them removed. You should hang on to your human lens as long as you can. When is the point that you need cataract surgery? Well, whenever you're not able to function and enjoy life. I'm 72 and I got early cataracts in both eyes. I think everybody gets early cataracts after the age of 50. That doesn't mean you need surgery. So the point is, what can we do to help slow the progress? And when should we have surgery? Certainly if the cataracts advance to the degree where you can't function. When I did mission work in Africa, I saw young people in their 20s and 30s that were totally blind from cataracts. I mean, they couldn't even see motion in front. They were so bad off, because I think a lot has to do with nutrition. I don't want to go into a lot of detail, but I would encourage you to listen to my webinar on alternative treatments for cataracts. And you can get that on my website to listen to that. So I think my protocol can be very, very helpful. I've helped a lot of people reverse their cataracts and improve their vision and prevent the need for cataract surgery. But to be honest with you, out of all the conditions that I treat, cataracts are probably the toughest. And the reason is, we really got to look at the underlying cause. And that's why I have an interest in homeopathy and nutrition. One of the biggest factors for the development of cataract is our poisons in our diet. The big poison is sugar, salt, and hard water, excess amount of minerals, bad minerals, and heavy metals. So many studies have shown that elevated lead is linked to cataracts. And if you have cataracts, I can guarantee you that you have elevated lead. Just about 90% of everybody I see that's tested has elevated lead. So we have to address that through some type of detox. And I have a couple of webinars on that, and there's a chapter on detox in my book. Other questions? So you can unmute yourself to ask directly, or
Yes, I fit the category you were just talking about. I wasn't having much problem at all with cataracts, and my optometrist unmercifully pushed me to an ophthalmologist to have cataract surgery. I was getting along fine without that, and I noticed after my surgery, a year or so, everything started to deteriorate to the point now where I've got glaucoma and decreased vision, where I can't drive anymore and I can't read very well anymore. And it's been a downhill drive, excuse the pun, since then. Several months ago, I saw my ophthalmologist, and on a regular appointment, they noted that my pressures were way up in the 30s. And that was the first time they've ever been that high. And he suggested that there was spiking every once in a while, and I needed shunts. So he made an appointment to see one of his compatriots, I like that word, to do the shunts, and since he didn't do that himself. And I had an appointment which I canceled a couple months ago because I wasn't quite ready to go through another eye surgery, and I wasn't really sure about the shunts. What's your opinion on shunts?
Well, one thing, glaucoma is a very serious disease. And I would encourage you to listen to my webinar, watch my webinar, The Big Lie Regarding Glaucoma. And the big lie is this: traditional ophthalmologists only look at the pressure. They don't look at the nerve. Glaucoma is a disease of the optic nerve. I've seen people with pressures in their 20s who never lose vision. And I've seen glaucoma patients with pressures that are 5 and go blind. What can we do to get that optic nerve healthy? And of course, common things: good diet, nutrition, exercise, hydration, everything you can do to improve your overall health. And my interest has been in stimulating the optic nerve using microcurrent, light therapy, ozone treatments. All these things can help the function of the optic nerve. My advice to you is, when your pressures are 30, even though I'm against eye drops and shunts and laser treatment, something has to be done to lower that pressure. The shunt is a surgical procedure. First, I would opt for, getting eye drops to try to lower the pressure. And also at the same time, maybe consider a laser treatment, which is less invasive than the shunts. And at the same time, begin some alternative treatments that might help lower the pressure.
Well, I have been using your program for a couple months now, the microcurrents and everything you suggested. And I've been on a lot of supplements for a long time. When my pressure was noted to be high, he put me on my 5th lower pressure eye drops, Ropressa. And I took that for about a little more than a month, and I quit that on my own several weeks ago because I was getting a side effect from the Ropressa, decreased vision due to more blurring and fogginess, which is a side effect they noted on their package insert. I was also getting a lot of pain waking me up in the middle of the night, which was also on their package insert. So when I quit the Ropressa, that all went away. I still had my foggy vision though.
Now,
most
when was the
people
last time? When was the last time I reviewed your records?
a couple months ago.
Yeah, I would probably need to look at your records and see what's going on. We may want to change the homeopathic remedy. Also, one of the most beneficial things you can do for the side effects of glaucoma drops is using ozone eye drops.
Well, I
Ozone
have been
too.
using those daily, all day long.
Excuse me, it's probably been since called August that we started, that he started.
Mhm. But send me,
I'm on 4 drugs already in my records that you reviewed for lowering the pressure, and my pressure's always been running in the mid-teens, and every once in a while it's gone up a little higher to the high teens, and that's always been a clue that he puts me on another lowering pressure eye drop. So the 4 I'm taking now seems to really be doing the job, except for this one time where it spiked.
yeah, well, then we have to try to find out why it spiked.
Well, I did notice that my vision certainly decreased after that spiking, because I did have 1040 in my left eye, and I was still able to drive. And after that episode, it seems that that's all over with.
Well, send me a copy of your records and we'll have to review everything, and I'll give you my opinion.
Well, you already do have a copy of my record. I really don't have any.
No, a recent record.
Okay,
Like when you go tomorrow.
all right. I
Yeah,
have
I
an
need a
appointment
copy of
set
the
up
recent
tomorrow.
record. 3 months ago isn't, it's not a snapshot of what's going on now, especially
Right.
since the pressure went
Right,
up.
that's an eternity. Yeah, I have an appointment tomorrow, so we'll probably be able to do that.
Okay. Keep me
Thank you.
posted. And somebody has their hand up. Is that Dr. Rose?
Yes, yes. Okay, so I have a couple questions. I have emailed my records off to you. You haven't gotten them yet. I just did that yesterday. But we're talking about glaucoma, and I've had the shunt or the sleeve, whatever they call it. I did acupuncture for a while. That helped a lot. Now they want to do a cornea. I keep getting bacterial infections, and I read in your book, the doctors, I asked them why I keep doing that. They have no idea, but I read in your book why, because I've had cataract surgery and everything, and I have severe dry eye. So they want to do a cornea. He said it was not a surgery, but it's like a buffer or something to clear up I don't know. I don't go in until December on that, but it's like, I'm here to find out if you can help me, and I'm ready,
Well, I like the ozone eye drops, usually for
Okay.
corneal inflammation and infections, ozone eye drops. They're
Okay.
using ozone now to disinfect swimming pools. It's a very natural way. It's not an antibiotic. It's a natural way of fighting bacteria, infection, and inflammation in the eye. The only drawback with ozone is that you have to make your own, which in a way is kind of safe and helpful because it doesn't have any preservatives in it.
Yes.
So I would definitely go to YouTube and search my name and ozone. I have a YouTube video on how to make ozone eye drops.
Okay, and I think I've seen that. What I've had, to me, it seems reasonable. I've had 2 surgeries that have failed with the sleeve that they put in. Instead of a trabeculectomy, they put in a sleeve, is what they called it.
Well, there's a lot of hype. There's a lot of hype over these sleeves, and there's so many different shunts that they're using. And I think it's going to come to pass.
I agree. I agree. So to me, I don't want any more outside, even if they say it's not a surgery. I want to treat homeopathically and regular, I don't want any more surgery because it seems like the eyes
see,
can
the
only.
problem is glaucoma is a very serious condition.
Yes.
If your pressure is elevated, sometimes you have to bite the bullet and you need surgery. But at the same time, my approach is doing everything I can to keep that optic nerve healthy.
Yes.
And, the microcurrent improves the circulation of the nerve. Chelation therapy opens up the little tiny blood vessels, light therapy. And of course, one big factor is stress reduction. When you're anxious and upset, that decreases the peripheral circulation when you're in the sympathetic state. And unfortunately, when you have a high pressure and you're losing your vision and you're going blind, it's hard to relax. But that's why you need to do certain things, deep breathing, positive affirmations, exercise, all these things can help. So we really have to focus on anything we can do to, help the health of that optic nerve.
Great. Well, I'm on board. I'm just waiting for you to see my records and we'll go from there. So.
All right. I'll
Thank
keep
you.
my eyes open. I'll talk to Chris and
Yeah.
get an update on that.
Thank you.
There's a question here about COVID. And yes, COVID has caused a lot of problems that I see with the eye in terms of dry eyes, inflammation, affecting the circulation in the back of the retina, all these things. So, I think the alternative treatments certainly can help, the homeopathy, the microcurrent, all these things. I I do have a couple of presentations on the alternative treatments of COVID. And I'm a member of the American Institute of Homeopathy. And if you search that site, the American Institute of Homeopathy, they have a couple of very good presentations open to the public on the homeopathic treatment of COVID. One of my YouTube's video was banned from YouTube, and I almost lost my, so I really can't comment about any alternative treatment. I have to follow the line of WHO in terms of the proper treatment of COVID. But if you go to the American Institute of Homeopathy, they have a great presentation of successfully treated cases of COVID.
Thank you.
There's a question about Oclamed. They're using Oclamed for 2 weeks, but having some pain inside the eye. Well, the big question is what's causing the pain? It's unlikely the Oclamed's causing the pain. You should probably get an eye evaluation because it could be a type of glaucoma. You know, when the pressure goes up quickly in your eye, you will get, eye pain. So that should be evaluated. Here's a question here about ozone eye drops and uveitis. I would be very cautious using ozone eye drops for uveitis. It depends on the severity of the uveitis. The ozone eye drops are primarily for treating inflammation on the outer part of the eye. You know, the cornea, dry eyes, conjunctivitis. Uveitis is an infection inside the eye. So very little of the ozone is absorbed inside the eye. In that particular situation, you might want to consider IV ozone. You know, ozone can be mixed with blood and injected into the body. That would help the systemic inflammation for the uveitis. But uveitis is another one of those diseases that is like glaucoma. You know, I wear 2 hats. I'm a board certified ophthalmologist and that homeopathic doctor. Certain diseases, you need the best of both worlds, the best of traditional and the best of alternative. And I would never tell somebody with uveitis or glaucoma, you don't need the eye drops, you don't need the medication, you know, just use the homeopathy. No, I never approach disease like that. My goal is, let me help you get your body stronger. And then when you go back to the eye doctor, he's going to say, oh, you're doing so well, we can cut these eye drops, or you don't need this treatment anymore. That's kind of my goal. Question here about, have you seen any help with water fasting? Well, I think fasting can be beneficial, but I would not advise a water fast. Well, first of all, I don't know what you mean by a water fast. Are you just fasting and drinking water, or are you eliminating water? I think fasting is good because it can help stimulate some of the regenerative processes in the body. And one of the biggest problems for poor health in the US is obesity. I think anybody can, just drinking water, that's what they responded. I wouldn't advise that because you do need good nutrition. I would be very cautious with the water fast. And there's a question here, any suggestions for myopia of the eye? Well, most of my interest is in treating eye pathology. Myopia is a refractive error that can usually be treated. A lot of studies have been done to show that high sugar, eye strain, not relaxing your eyes can lead to myopia. And I do believe that microcurrent and light therapy can help. But that's not mainly my interest. My main interest is in treating eye conditions that are progressing to visual loss, like macular degeneration, glaucoma. There's an organization called the It's the College of Vision Development, COVD, College of Vision Development, and also the College of Syntonics, SYNTONICS. These are two groups of eye doctors who specialize in helping to improve the health of the eye and reducing myopia. So you may want to contact one of those organizations, College of Vision Development and College of Syntonics, SYNTONICS. I like the College of Syntonics because they're using light therapy to help reduce the progression of myopia. I interviewed the past president of the organization, Dr. Larry Wallace. And if you go to my podcasts, you can listen to that interview. He was also a featured speaker at the Vision event. And I think all of you have access to those recordings. Just go to my home webpage and there's a icon there on Vision event. You can listen to Dr. Wallace. Other questions?
I have a question about sometimes people get a membrane on the back on the retina or on the, just in front of the retina, and that obscures some of the vision, and sometimes they suggest a surgery for that. Do you know, have you any inklings on the causes of those membranes or positive treatment for that?
Those membranes, it's a macular wrinkling, membrane, macular pucker. There's all sorts of names for that. And the way that develops is as we get older, the jelly, the vitreous jelly inside the eye pulls away from the back and starts to shrink. And sometimes that causes a wrinkling or a membrane. And I think a big contributing factor to that is inflammation. If we can reduce the inflammation, and the basic steps to reduce inflammation are a good healthy diet, avoid toxic food, keeping yourself well hydrated, reducing stress, and then my goal is to use treatments like the microcurrent to reduce inflammation, light therapy, and homeopathy. I did have a subset. I published an article on the alternative treatments of different eye conditions, and there was a subset of macular membranes, wrinkling, and puckering. And if you go to my website on the home page, there's a link for studies, and you can review those studies.
Brilliant, thank you.
The problem with it is the surgery that they do. And the surgery invariably leads to the development of a cataract. So it's kind of a tough situation. And I would try to do all sorts of basic alternative treatments. My advice is, so many of you, when you start to develop an eye problem, you have to look at what is the underlying cause of the eye problem. And you really got to look closely at, your diet and nutrition, your lifestyle, exposure to toxins, all these things. I think that's the first step. That's why I really encourage everybody to download my book. The first 3 chapters are nutrition, healthy nutrition for the eye, proper hydration, drinking good water. Priscilla, I see you have a glass there. All right. Cheers. She's keeping well hydrated. And also reducing stress. That's a big factor. The body will not heal if you're in a stressful state. And I think a lot of times traditional ophthalmologists put you in a stressful state. If you don't have surgery, you're going to go blind. And if you don't take your eye drops or don't listen to me, I don't want you as a patient.
Yeah.
They don't look at it as a partnership. They look at it as a dictatorship, which is kind of unfortunate. Question here on migraine headaches and vision changes. Well, the migraine headaches is a vascular problem which can affect the eye. The migraine, there's a constriction of the blood vessels, and it's temporarily, and you can have visual problems. Homeopathy, light therapy, and microcurrent can be very, very effective for treating migraines. Other questions?
I have a question. This is Yana, Ron's wife. Can you use the ozonated water on your face?
Oh, definitely. Definitely. In fact, some doctors have ozone saunas where you put your whole body in and you sit in a sauna.
Great, thank you.
So you can put the ozonated water on a washcloth and put it on your face. So ozone, I love ozone. Ozone is just a wonderful, wonderful treatment. And part of my goal is to empower patients. Once you invest in an ozone generator, you can ozonate the water for drinking. You can ozonate water that you're cleaning your vegetables. I had some problems with some fungus on my feet, and as I was sitting doing computer work, I was bubbling ozone in a foot bath. And of course, the ozone eye drops are very, very soothing for the eye. My wife loves the ozone eye drops to keep her eyes moist and help treat dry eyes. The other interesting thing about ozone eye drops, not only is it therapeutic to help reduce some of the symptoms with dry eyes and maybe inflammation, it's also therapeutic. I think the ozone helps with regeneration. There's been studies to show that ozone increases oxygen uptake, improves the activity of cells. So it also can be helpful for regeneration. But just remember, the ozone eye drops are not absorbed into the eye. So I don't think it's an effective treatment for cataracts or macular degeneration. It may be of some benefit for those of you that have glaucoma to help reduce the side effects of the eye drops, because some of these glaucoma eye drops are nasty. Somebody mentioned Ropressa. I mean, they burn, they cause redness. But many of you as a patient are between a rock and a hard place. You need to get that pressure down, and you have all these side effects from the eye drops. Looks like Dr. Rose's hand is up. Dr. Rose, you had another question?
Yes, I do. This is fascinating, learning about the ozone. So you can drink it. How much can we drink safely? I mean, if we inhale it, I understand that it can be maybe not as good, but
Right. Ozone is very toxic to the lungs. You
okay.
don't want to inhale it. Been drinking ozone, but I would think that it's not going to be toxic. It's like asking me, how much water can I drink? Well, if you drink too much water, it could kill you. You could develop hyponatremia and have a seizure and die. So, but I do think drinking. I have a rule of thumb: you should drink half of your body weight in ounces of water a day.
Yes.
So
So
you could drink ozonated water.
okay, half the body weight in ounces of ozonated water a day.
Yeah, if you're interested in drinking ozonated water. But not all of that ozone is being absorbed. I think a very small amount is being absorbed.
Oh,
Because once it goes into your stomach, the acids interfere with it.
okay. This is what I was wondering, like, your normal water per day, you could go ahead and ozonate and you would be pretty safe with that.
Mhm. Yeah, somebody asked, what is the proper concentration of ozone for eye drops? Well, typically when you're making ozone eye drops, you're using a ozone generator that does not use an oxygen tank. When you're doing rectal insufflation or auricular, you're using a tank of oxygen. And that has a much higher gamma or concentration. We usually recommend 24 gamma. But for ozonated eye drops, it's a much lower gamma, maybe 4 or 5 gamma. So all you have to do is you get your ozone generator. It's like a little aquarium bubbler, and bubble it into saline for maybe 10 to 15 minutes, and it's ready to go. The half-life of ozone in saline is probably about 2 hours. That means that in 2 hours, half the ozone is gone. So those of you that are using it for eye drops, I recommend you ozonate it in the morning. If you're home at lunchtime, ozonate it, and then in the evening, then you'll have a fairly good concentration. But even after 24 hours, there's still a little bit of ozone in the saline. And you have to play around with it. Some people are sensitive to a high concentration of ozone. Others can tolerate it. So if you do have some burning, maybe it has too much ozone. But most people can tolerate a high concentration of ozone. And the question about the ozone videos, I have 3. One for making your own ozone eye drops, one for auricular ozone. That's where you get a stethoscope and you can put it in your ears and run the ozone in, and also for rectal insufflation. And I have a video on each one of those.
Okay, so,
Oh, excuse me.
well, my other question is kind of like when you take it in the body and like drinking it or through the ears, I know it's a detoxifier, correct?
No, it's really not a detoxifier. It stimulates the body, oxygen. Oxygen doesn't really detoxify the body.
Okay, thank you.
So if you are interested in, well, it may detoxify the body by stimulating a lot of the, organ functions.
Okay,
Okay.
thank you. I was, if there was congestion in the head, doing the ears would help to get the organs moving so they could do what they need to do to detoxify.
Right. Mhm.
Okay.
But if you really wanted to detoxify, then I'd look at other methods, proper hydration, drinking plenty of water. Water is the best way to detoxify. Then also, there's numerous chlorella, vitamin C, zeolite, and of course, my favorite is EDTA. EDTA is a powerful way of detoxifying the body, getting rid of the lead and heavy metals. And then there's infrared sauna, all these methods.
Thank you.
And there's a question here about MSM eye drops, and I really don't recommend MSM eye drops. I experimented with it in the past. My favorite eye drop is Oclumed. I think that's one of the few eye drops that I've had success with. Oclumed, where I actually have had patients with reversal of cataracts using the Oclumed in conjunction with light therapy, microcurrent, and homeopathy, all those things. But the important thing to remember, so many of you have made comments that after your cataract surgery, you developed other problems. And the point I want to make is that, the cataracts are kind of a warning sign. Just don't get them removed. Find out why you're getting the cataracts. Cataracts aren't normal. Well, you could say that aging is normal, but I'm 72, and I've seen people in their 80s and 90s that don't have cataracts. So if you are getting cataracts, I think that you have to look at why. Is it nutritionally related? Is it due to toxins? We have to investigate that and treat the underlying cause. That's more important, because if you don't, then it's going to lead to macular degeneration, maybe Alzheimer's, Parkinson's, other neurological problems, etc. How does traditional neurology and ophthalmology work together? Well, ophthalmology is a subset of neurology. You know, the eye is part of the neurological system. And certainly, you know, the eye and the occipital lobe are connected. So essentially, an ophthalmologist is a neurologist, and a neurologist has to be somewhat of an ophthalmologist. So they do work together. And there's a comment here about using light-colored washcloths. I agree, because if you have a colored washcloth, there has to be dye and chemicals in it to make that color. So you don't want to use a colored washcloth when you're doing microcurrent or any type of treatment, because a lot of those toxins in that washcloth could be leaking into on your skin. And there's a question here about birdshot uveitis, and that's a type of uveitis. And of course, we want to reduce the inflammation. And the way to reduce the inflammation, there's many, many different ways. The microcurrent, ozone treatment, light therapy, homeopathy, all those treatments can be effective. The goal is to try to tailor a program that'll help your particular inflammation. And of course, at the same time, I'm looking for what is the underlying cause. You know, where did that inflammation come from? How can we treat the underlying cause? Now, many people will blame their problems on candida or infections and things like that. But if the body is strong, you're going to be able to naturally fight infection. But if your body's weak and debilitated, you're going to be more prone. Now, maybe physically you're strong, but maybe mentally, emotionally, you're weak. When you're under stress, your body is more susceptible to developing infections. Question here, how do you know if you have a cataract? Well, if you're over 50, I promise you, you probably have an early cataract. That's like if you're a woman over 60 and you go, doctor, how do I know I have wrinkles? Well, if you look hard enough, you're going to see that you have a little wrinkle here and there. It's part of aging. But on the other hand, some ladies are in their 60s and they're absolutely beautiful. My wife, she's in her 60s and I don't see a wrinkle at all on her. She's beautiful. But on the other hand, I see some people that are in their 60s and man, they look like they're 80s or 80 or 90. You know, they've led a destructive life, being exposed to toxins, maybe smoking, heavy metal toxicity, all these things.
I have a question, if no one else does right now, about heavy metals. If one's breastfeeding, is there a safe way to do a heavy metal test? And is there a safe way to chelate other than perhaps, you know, the food cilantro and foot soaks? Or yeah, what's your thoughts on that?
You have to be really careful if you're breastfeeding, because you know you don't want those chelating agents going to the baby. On the other hand, maybe the chelating agents in moderation may help the baby, because if you do have elevated lead, then there's a good sign that some of those toxins will be in the breast milk. So I think that's a question for your pediatrician. I think it is very low levels, but I don't want to give any advice. I would ask your pediatrician that.
Thank you. Thank you very much.
Question here about acetylcarnosine, can C. Acetylcarnosine is one of the ingredients in Oclumed. And acetylcarnosine is a glutathione precursor. Studies have shown that when you do develop a cataract in your eye, the glutathione levels and ascorbic acid levels decrease in the fluid around the lens or the cataract. So it makes sense if we could increase the glutathione and ascorbic acid or vitamin C, it'll reduce the growth of the cataract. Now, if you listen to my cataract webinar, there's a brilliant researcher, Dr. Levy. Everybody's familiar with scurvy. Scurvy is a condition you get when you're deficient in vitamin C for a long period of time. Your teeth start to fall out, you know, you get lesions and your collagen is just destroyed. That's full-blown scurvy. He talks about focal scurvy. Bifocal scurvy, it's a moderate vitamin C deficiency that he feels causes cataracts, heart disease, periodontal disease, etc. That we do need higher levels of vitamin C. So you may want to watch that webinar, and I do recommend that, you know, cataract patients do take maybe a little bit more vitamin C. But the problem is, where are you going to get a good source of vitamin C? I've been very, very disappointed. There's so many manufacturers now that are using vitamin ingredients from China, and they're contaminated. One of the most common sources of vitamin C is corn. And something like 80 to 90% of our corn is genetically modified. So we're getting that genetically modified material in our vitamin C. So it's becoming a nightmare in terms of nutrition and dietary products. And I've been doing a lot of research on trying to find good, pure vitamin lines. That's been kind of an interest of mine. In fact, I'm in the process right now of researching good vitamin products. But the bottom line, I think, is food is our best medicine. If God wanted us to take vitamins, he would grow it on trees. So if you have a good source of organic food, take advantage of it.
I had a question also. At one stage, I heard that you were thinking about developing your own eye drops, combining different things. Is that still something that you're thinking about sometime?
It's too difficult right now.
Or are you happy with that?
The FDA has so much in the way of regulations, it's almost impossible. Almost impossible. In fact, you know, they're clamping down on homeopathy. There's a movement on our way to ban homeopathy in the United States. So that's kind of scary.
Ouch.
That is.
So you might want to visit the American Institute of Homeopathy, their website. It's a wonderful organization. These are medical doctors who are homeopathic doctors. And I think you'll find it fascinating. I'm proud to be a member of that organization.
That was the American Institute of Homeopathy.com, .org.
I would just Google the American Institute of Homeopathy, and you'll probably come up with our website. Interestingly, the American Institute of Homeopathy was founded before the AMA. The only reason the AMA was founded was to fight the homeopaths, and they're very successful. And the reason, they have all the money from Big Pharma. In the 1800s, you would buy a medical journal and there wouldn't be one advertisement from Big Pharma. Now you pick up a medical journal, it's like reading Cosmopolitan magazine. Every other page is an article for a drug. So essentially, Big Pharma is running medicine. You know, doctors are essentially distributors of Big Pharma.
Yeah.
They say the average doctor, when he sees a patient, in a couple of minutes, he knows what prescription to give you. He's not really treating you, he's just giving you a pharmaceutical, which is unfortunate. Deanna has her hand up. Did I pronounce your name right?
Yes, thank you so much. I wanted to ask you, I live in Germany, and I had a cataract surgery. And surgeon, basically, my lenses are already implemented. They have blue blocker agent inside. Blue light filter. So I'm wondering now, because it's just, I had it yesterday, should I at all use now blue blockers during the night and when I'm using devices, or should I refrain from that? I'm a little bit confused about that, and should I use it for the next 7 days, because now my eyes are still, you know, both of eyes were operated. So I'm just wondering, should I just first now adapt my eyes for the normal vision and then starting to use any kind of blue blockers?
Well, you said that your lens, the artificial lens in your eye, has a blue blocker?
Yes, has blue filter. Blue filter.
Yeah, well, then it's probably not necessary to use any blue glasses, because that's the only concern I have is that blue filter is blocking out the blue light that you need during the day.
Okay.
So in a way, it's like wearing the blue glasses all day long. I mean, the blue blocker should be worn at night, not during the day. But see, there's other ways that you can get the benefits of blue light. You know, ultraviolet light is essential for all life. And so, you know, spending some time outdoors and getting exposed to ultraviolet light is getting the healthy effect of the blue light.
Okay, okay. Thank you so much. I will now only see what's happening with my macula. It looks like that it's okay. But you know, you spoke about, and I just wanted to say to you, I'm 56 years old. And 2 years ago, I developed a rapid post-capsular cataract after receiving IV ozone therapy. And that came basically to oxidative stress. I couldn't detoxify, it was too much for my body. And it literally destroyed my lenses. You know, the protein is just came into, and that was so with IV, what I understood, it depends, you know, they said to me, because it was IV ozone, it backfired me. It was not doing anything good for me at that point. But anyway,
maybe you got too high of a dose. This was intravenous ozone?
Yes, it could be that was the reason, but I came to the point that I had to have a cataract surgery. I tried not to have, but what you said, I had a congested lymphatic system and vascular system, and maybe that's contributed even more with the pressure in my eyes. And now I just want to stay in a way healthy, because I'm listening that many of problems can come after the cataract surgery. That's why.
Yeah, well, you mentioned you had the posterior subcapsular, and that's usually due to inflammation, especially at your young age. You know, 56, if it's a rapidly growing cataract, that's usually due to toxins in the body.
Yes.
The thing about ozone is the ozone doesn't get to the lens of the eye. The lens is, you know, there's no blood flow. So if you're getting intravenous ozone, it doesn't go to the eye. It doesn't go to the lens. It goes to the eye. It goes to the retina. But something else must have been going on.
I think that it's heavy metal toxicity as well.
Yeah.
So that was the major contributor to that. But thank you. I just wanted to ask you about the nutrition. I will read in your book, but I'm always confused about the fruits. And do you consider like fruits that's a sugar as well, in a way? Because
I think it has to be a balance. You know, too much sugar from fruits can be very harmful. So I'm a big advocate more of a leafy green, colorful food. So fruits in moderation.
Okay, thank you so much.
Okay.
Thanks a lot.
Okay, well, we're coming to a close. I want to thank all of you for joining, and we'll be having these periodically. I'll be emailing you. And if you do want more information, you know, please go to my website, download my book, and give the office a call or email us. We're here to help you any way we can to help you with your vision problems. So I want to thank all of you for joining the webinar. Blessings to everyone.